Okay, so this will be taking care of the micro patients post-op, downstream and admit recovery, or Cornell one is where they're getting recovered as well, but y'all are starting to see them here as well. So this is much different from what you're expecting. Pacemakers, everything's done subclavian. We are now in the femoral vein here. And as you saw before, a 27 French sheath was pulled, and this is what's causing hemostasis instead of like any manual pressure or a closure device. It's a suture technique that's going to hold pressure on that site, prevent any bleeding from occurring. So what the doctor will do is he's going to create a figure of 8 stitch around the sheath that's out the body, and he'll get this kind of centered down, send the stopcock down, create hemostasis as he's pulling out the sheath. At that point, we're going to make sure, check around, we'll see no bleeding, no hematoma or anything like that. And then they're going to come to you all like this. So you'll see them typically like so. So then the big rule is strict bed rest. Please follow Dr. Goldberg's instructions on bed rest. It should be 3 to 4 hours, completely flat, and not messing with this at all. You're just going to check the site, make sure there's no bleeding at the site, no swelling, hematoma at the site. You can check for things like lower back pain or anything where there could be bleeding into the backside of your cavity near your kidneys or anything. Those can be signs that they're bleeding under the skin and we may not be seeing it. But strict bed rest until the orders say so. Then at that time, what you're going to want to do for the patient is kind of grab with your hand these 2 sutures. You will then open up the port. So what's happening is the sutures are running through a channel, closing off the port, cinches these in place so I can't move this anymore. You're just going to grab that, open your channel up, and while holding these 2 strings, slowly back off, let me get this out of the way, slowly back off this stopcock. If you are holding so much pressure with these strings still, you are basically still anchoring the site and causing hemostasis. So you're going to want to loosen up here, see that these strings are a little floppy, and check for any bleeding there. If you see any bleeding, you just immediately tighten it back up, send the stopcock back down, and just turn the port. And at the point, you're just going to have to contact the physician, let them know, and get instructions on how much further on the bed rest from there. If you are able to completely pull this off with no bleeding, and just take the stopcock off, you are welcome to have the patient cough, but have this still in place. It's a good check to see if they're going to bleed or not there. So a big cough or anything like that would be just fine. After that, if you feel comfortable, you will just remove the stopcock, grab 1 string, and just pull completely out. And there's no knot in here where you got to cut or anything. It's just 1 solid pull. Gauze, Tegaderm, and then they will still be on bed rest for at least another hour prior to getting discharged out of the facility.